Welcome to Reproductive Science Center. We look forward to taking care of you today. Upon arrival to RSC, you will check in with the front desk and will be greeted by one of our staff members. They will check your ID and temperature before entering the office. A family member or friend will be able to accompany you to a small waiting area where you will meet your admitting nurse. Your nurse will explain the process and provide instructions as well as pickup location to you and your partner or friend. Plan to be with us about 3 hours from the time you arrive to the time you are discharged. Our nurses are happy to keep your family or friend up to date on your progress during your stay and let them know when you will be ready for discharge. You will be admitted and recover in the same area. There is a locking cabinet for you to store your personal belongings. The nurse will begin to prepare you for your surgery and will ask you a series of questions pertaining to your medical history. You will change into a hospital gown, socks, and cap for your surgery. An ID band with your name, date of birth, and allergies will be placed on your wrist. The nurse will attach monitors to check your blood pressure and pulse. Next, the nurse will start your IV intravenous line that will deliver fluids through a catheter or tube inserted into a vein. This allows for fluids as well as anesthesia medication or pain medication to enter your bloodstream right away. An antibiotic might also be given through your IV, which is ordered by the surgeon in an effort to prevent infection. The surgeon, circulating nurse, and anesthesiologist will meet with you before your surgery. They will ask you a series of questions that will help us to care for you that day. They will be able to answer any questions you may have about your surgery. If you're having an egg retrieval, your circulating nurse may walk with you to the restroom before going in the procedure room. Having an empty bladder ensures better visibility of your ovaries during the egg retrieval. For some other procedures, you may be asked not to use the restroom until after your surgery. Next, you and your nurse will walk together to the procedure room. You will notice various medical equipment in the room, and it may seem colder than usual. We assure you that we will provide you with the utmost care to keep you safe and warm during your procedure. You will walk up to a window to meet the embryologist, who will be assisting the surgeon during your procedure. They will ask for your complete name and date of birth and check it against their paperwork and your ID band. The anesthesiologist and nurse will then assist you onto the OR bed. As you lay on the bed, the nurse will cover you with your blanket and will place a safety belt over your waist. Your mask will be removed and be replaced with an oxygen mask that will be placed over your nose and mouth. Other monitors will be attached to help monitor your vital signs during the procedure. You will feel the blood pressure cuff tighten around your arm and then slowly release. The anesthesiologist will begin to administer the anesthesia medicine through your IV, and you may feel a slight burning sensation as the medication infuses. This will eventually subside as you slowly drift off to sleep for your procedure. Since anesthesia affects everyone differently, there may be a slight chance that you continue to hear conversation between the surgeon, nurse, and anesthesiologist during the procedure. Immediately following your surgery, you will be taken to the post-anesthesia care unit. The nurses will apply monitors and an oxygen mask. The recovery nurse will care for you as you wake up and will offer you something to drink. You can anticipate being in the recovery room for 45 minutes to an hour. You can expect to have some mild cramps after your surgery, similar to menstrual cramps. We will ask you to rate your pain on a 0 to 10 scale, with 0 being no pain and 10 being very severe pain. The nurse caring for you will use the scale to determine the best plan of care. Please do not wait for someone to offer medicine. Let your nurses and doctors know right away if you feel pain. The recovery nurse will call your family or friend to let them know your status and what time to expect for discharge. The surgeon will review details of surgery and what to expect at home. The nurse will assist you to the restroom to make sure you're able to urinate before going home. We will also check for any vaginal bleeding, which is normal after the procedure. You will be given a pad or panty liner should you need one. You will return to your bed and the nurse will remove your IV. You'll be able to get dressed and will be ready for discharge. You will be taken down in a wheelchair to your family or friend for pickup. We look forward to meeting you and thank you for the opportunity to care for you.